Rikke, Anders, thank you so much for joining me here on Faces of Digital Health to talk a little bit about Denmark, regions and municipalities in the country. At the end of 2024, the Danish health reform was agreed with the aim of transforming how decisions are made. The happening is definitely vibrant, but let's start by explaining what do you do in the city of Copenhagen, and how is this whole reform affecting you in any way. So who wants to start?
Well, we could start first of all, thank you for having us here. My name is Rikke Selshoft-Arnarson, and I'm head of digitization in the Health and Care Administration here in Copenhagen. I'm very happy to be here. And maybe, Anders, you should...
I'm a digital strategy consultant also in Copenhagen. So our focus is pretty much on how digital technologies can make life easier for our citizens and for our employees doing community care. Maybe you should say a little about the healthcare reform.
I will do that. Yeah. So briefly, the Danish health reform from 2024 is really a response to the challenges we are facing right now, and a lot of other European cities and countries are facing. So we are having a growing elderly population, and more elderly people are living longer, and they're facing chronic diseases and conditions. And at the same time, we have a healthcare workforce that is under pressure. So the overall ambition is to move elderly care closer to the citizens and to create a much better coordination across hospitals and general practitioners and municipalities. And at the same time, the health reform also contains an outspoken focus on how digitization can ensure and help all these political ambitions in the area of ensuring easy navigation for citizens and health professionals when it comes to exchanging data and also delivering different parts of the health solutions in the domain.
I think it's probably pretty important to say that the reform is not starting from scratch. Digital health and digitalization in health in Denmark we've been working with that for decades. So I would say that the reform is very much building on previous work from further years. So from our part that we've been working with telemedicine, we are testing a home-based hospital care. We're doing virtual discharge from hospitals. So many of the things that are in the reform is actually something we've been doing and preparing for the reform. We've just not been calling that. So you can say the reform is not so much a revolution for us in Copenhagen. It's more an acceleration to things that we've already been working on for some years and some in recent years.
Yeah, absolutely. As you mentioned yourself, Denmark has a long history of healthcare digitalization. You've had the patient portal since 2002, which is long before most European countries began digitizing patient access. I recently spoke to Morten Elbak Petersen as well, who's the CEO of the patient portal. So I'm going to make sure to add that in the show notes in case any of the listeners want to research that as well. So given that, digitalization is not something that's new for you, what are the biggest challenges that you are anticipating in 2027? The implementation is supposed to start. So what exactly do you expect will happen before that? So how are you preparing for the adoption before the full planned implementation in 2027?
I'd say of course, there's a lot of things happening at the national level right now, preparing for the reform, because we're also going from 5 regions to four regions. We're moving tasks towards the citizens from the municipalities to regional responsibility. So there's a lot of things going on at the national level right now. But as for the digital ambitions, I'd say the things that we're already working on, we're continuing that work, and that will fit very well with the ambitions of the reform. And some of those that's telemedicine. It's also data sharing across the different actors between us, the general practitioners, the hospital. We need that. We needed that before, and we need that even more. And that's some of the digital ambitions that are the focus of the reform as well.
If we try to illustrate how care is digitally supported on the community level, can you describe what's already there? So what's already used in Denmark from the digital perspective on the community level?
The community level, first and foremost, the municipality role is quite broad. We're responsible for services concerning home care, nursing care, rehabilitation and training and care homes for elderly citizens. And we also work with prevention and health prevention, for example, supporting citizens with chronic diseases. And all in all, we would have digital support in all of these tasks which are performed by our staff. Also, we would have a digital solution supporting the citizens in their contact with public sector, and sometimes also both, of course, the elderly people we are delivering health services to, but also their families and people supporting them in their everyday life.
I think what's important to say that we have a large collaborations with the others, like when citizens move between their own homes, their care homes. We have 39 care homes that we operate in municipality. When citizens move between their own home, the hospital, the temporary care home or permanent care home, we have a lot of collaboration. So that's for instance, you can say a nurse that provides home care, when she discovers that something is different with the citizens, maybe she'll need to contact the hospital to say, well, how do we handle this in case there's a need for hospitalization? We'll digitally communicate what are the background for this citizens to the hospital, so the doctors at the hospital will have that to base on their diagnosis and treatment of the patient. And similarly, when she's discharged from the hospital, we'll have digital communication that will tell us what care will we need, what special needs will she have that are different from then when she was hospitalized. So we have a lot of digital communication to support this kind of collaboration.
Mm-hmm. So the collaboration between the care homes and the hospitals.
Exactly, and the home care that we are also responsible for, and also general practitioners, of course. Luckily, not everybody needs to go to the hospital when they become sick, but we also have a lot of work with the general practitioner, also digitally.
Do you know if to which extent are systems interoperable between the care facilities, so the elderly care facilities? You mentioned there's 39 in just one municipality.
Exactly.
Because usually what oftentimes happens is that care homes would use their own software. They would use different things and different types of hardware and software solutions to support care, but that would be kind of separate from any other IT infrastructure, and then there's nobody that would be willing to do the integration between the systems. So is that different in Denmark? I also must say that it's worth emphasizing that 39 per municipality is a lot, which is also something that I guess Denmark is famous for. It has a tradition of building elderly care homes, so it's clear that younger generations are not going to be responsible necessarily for the elderly, as it is the case in some other countries.
Yes. I can say I can add we have 6,000 citizens in those 39 care homes. So yes, it's quite a large operation that we're running. In the municipality, we have the same system for everybody. That means our home care, our 39 care homes, rehabilitation centers, they all use the same care record. As for your question about what about the other actors, the hospital, the general practitioners, I'd say, I think, was it in the 80s? I think MedCom, medical communication, was established in Denmark, and that's the standard for all this information, both between hospitals. It's about medicine. So when a general practitioner prescribes medicine to a citizens, we can see that and operate based on that, and that's the MedCom infrastructure that enables that. Also, when citizens are hospitalized or discharged from hospital, it's the MedCom infrastructure that enables Denmark to have this communication between all the different care homes, hospitals, general practitioners, and so forth.
An important part of this is also that community care is not only operating in isolation. So our systems are connected to the broader Danish healthcare infrastructures. And for example, and that's a landscape where you have different parties delivering different parts of the healthcare using different kind of healthcare systems. So that means that exchanging information digitally between those actors can be a bit difficult at times. Still, we would also have infrastructure helping us delivering healthcare in this area. But citizens, they move between sectors. So, for example, from a hospital to a municipality and back. So we are working on ensuring that data is following the citizen in their way through the Danish health sector.
Something that is a goal for many countries and regions across Europe and beyond. When we talk about the quality of care, access to care, healthcare digitalization, it sometimes differs on the region that we are discussing. So Denmark has 6 million people divided between 5 regions. How do you see the different level of development that these regions have? Is it the same across all the regions? Do you see regional differences in that sense?
We do see regional differences, but of course we also have a digital system binding us together. One example is the common and the common medical record, which is shared between municipalities and regions and the state government. So in that way, we would have both systems supporting us between sectors, but also, of course, individual systems designed especially for example, for a municipality caretaking setup and the other way around, specialized systems for hospitals.
So it's clear that, because the strategy has been there for so long, it's the digital part is trying to kind of bridge the potential inequities that would exist because of the regional differences, or
yeah, but also there has been invested heavily in shared infrastructure and common standards. So we have been moving in that direction through several years, but we still have a road to walk, so to speak, when it comes to ensuring standardization and continuing that work.
Yeah,
and I
absolutely.
think local innovation has also been a part of a big part of this. So municipalities like Copenhagen, we have room for innovation, for developing solution, but it's based on this common national infrastructure that we have. So we try to or we do use the common components that we have and operate from that. And then as for your questions, are there differences? Yes, of course there's differences, because there's different political priorities and focus. So that's also part of the picture.
Absolutely, that's always the case. And as far as innovation goes, as long as technology keeps changing and developing, there's always going to be space for innovation and improvement. We're gonna get to AI a bit later. I wanna ask another thing. So ambitions are very high and clear in Copenhagen. You want to focus on prevention, on fast recovery, and effective rehabilitation in case of a problem. But there's one thing that stood out to me when I was reading some of your plans, and that is that you're not focusing just on patients, but also on relatives. And relatives, caregivers, are the group that's often forgotten, left behind, not in the forefront of efforts when we talk about the impact that somebody getting sick has on the broader ecosystem or environment of a patient. So can you tell me a little bit more about that? How are you planning on enacting these strategic goals in practice? What exactly are you doing for relatives?
Well, one thing is that when we approach elderly people, part of the beginning interview with them is to explore if they have resources in their close family. Do they have relatives who can be a help for them, and maybe already is a help for them in their everyday life? So when it comes to the digital support in that area, it is an important tool to ensure the engagement of relatives when it comes to our elderly citizens. Therefore, we're working on delivering app-supported dialogue with relatives and elderly people, but also through telemedicine, for example, make it possible to have relatives involved when an elderly person have the dialogue with the municipality. But of course, different citizens have very different resources, but that is both when it comes to the elderly people, but also their relatives. And we need, in order to create more equality in health, also then we need to be able to approach citizens and their relatives differently, taking into account how they feel about the digital communication when they are having the dialogue with us.
Mm-hmm. And is it so? Can we go through an example? Where does this discussion with the elderly person happen? Does it happen when they reach the healthcare system, for example, when they're hospitalized or go to a GP? Is it social care that does kind of the research about the support system that an individual has? And can we just see what those different scenarios look like? So if somebody does have family near, and if somebody doesn't have the family near, what happens then?
I can tell a little bit about the process here in the municipality. And when we first approach an elderly person, we would typically have a conversation with them about how their level of functioning is to be considered, what kind of help they would need, and so on. And during that conversation, we would also have a dialogue on how this citizen would prefer to have involvement of relatives. So that would be in the first encounter with the citizen, so to speak. But of course, there are citizens who don't have any interest in involving their relatives in their situation or in their healthcare activities, and so in such matters, we would of course respect that preference and just take into account what the preferences and the needs are in such cases.
It's I just remembered one more thing. So earlier when we were discussing the good infrastructure or the numerous infrastructure for elderly care, how accessible is it? So what's the availability structure in Denmark, meaning that I'm just gonna go from my own perspective in Slovenia. First of all, there's a shortage of infrastructure, and then the second problem that elderly are potentially facing is that the access or the pricing is not affordable for everyone. So given that you have such a large infrastructure, is affordability less of an issue for the elderly should they need care in a care home? What's that perspective like?
You mean affordability for the services or for the access to the digital infrastructure? I just need to understand the question.
Yeah, so basically this is not really a digital related question. It's more a question of accessibility. If you want to, or if you have to move into an elderly care home.
In Denmark, the care services and the health services are free. That's tax funded. As for so that's free. So affordability is not an issue there. So home care is tax funded in Denmark. As for the care home, you need to pay rent, and that's just it's different if the houses, the care homes are owned by the municipality or a property company. Actually, I think typically in Denmark it's a property company, and it's normal rent charges as for if they took a normal apartment. And the main difference is then that at the care homes, there's also staff from the municipality providing the care services that the citizens has a right to get based on their conditions.
Right.
So
Okay.
affordability in Denmark is I would say not an issue. Of course, you have to pay rent for your own home, and that's no different if you're living in a separate
elderly care home. Yeah. If we go back to technology a little bit, we discussed interoperability, we discussed a little bit the digital infrastructure and how data is following the patient. What about AI? How much are you exploring AI? What do you expect to see used in practice in the upcoming years? Where do you see the potential? Where do you potentially not see the potential? Are you already testing anything?
First and foremost, we see a great potential when it comes to AI. It's an area where we would see a lot of potential when it comes to supporting our staff in their daily work, but also supporting our citizens. And one very good example is the work with documentation. In the community care, there are demands on documentation at a level where, as a staff member, you would sometimes feel that it takes a lot of time, and sometimes maybe also take time from the service you could have delivered to a citizen. But it is an important part of the job. So in spite of the fact that it takes a significant amount of time for nurses and care workers. So one thing we are examining and exploring is how AI can reduce the administrative burden for staff members. And more concrete, we have looked at the possibilities of delivering a digital service which automatically take up speech and translate it into written language, and also makes categorize information and making sum ups from what has been said and what has been
done in the consultation.
Yeah, exactly.
Yeah. Are there any projects that you can mention that are currently happening in the city of Copenhagen? So what are the key goals or the key projects that you want to have done by the end of the year or next 2 years strategically?
Well, the solution I just mentioned, we're calling it talt, which means spoken in Danish, is a solution which we have made a proof of concept on that, and right now the municipalities are working on making a project across the different municipalities in Denmark to ensure that when the legal framework is ready, we will be able to implement this solution in order to ensure that the staff members in doing care work will be able to use less time on documentation.
And the value here, I think that's what you're also asking about, Sasha. Why is this a priority? The reason for this is our care workers actually spend quite some time on documentation, and I suppose it's the same in other countries as well. So some of them are not so fluent in Danish. They're not native Danish, and they have some of them have a short education. So written language is not their first skill or highest skill. So documentation is actually quite difficult for some. And as they haven't gone into care work in order to document, they've gone into care work to take care of citizens. So this is actually an area where we can say we can reduce some of the work that is taking time away from the citizens, and in view of the aging population. We really need to maximize the time that they can spend on our citizens.
Absolutely.
So that is why we are really looking into that as a high potential. Also, quality of data is an important objective of this, because we have 10,000 care workers in the municipality of Copenhagen. And in order to maximize our value of data, we need to have uniform data. And we also hope that and expect AI to be able to make more uniform documentation, so we can use that in the future even more than we do today.
Yeah. As always, it's worth being a little bit cautious and test technology before it's implemented widely. So I'm sure in a year or so, or even earlier, you're gonna have even more information on the broader impact that this might have. So Rikke, Anders, thank you so much for joining me for this discussion, and good luck with all your projects.
Thank you.
Thank you so much.